Welcome. Today we're diving into the absolutely fascinating world of pediatric neurology. And it's a field that's really built on one critical idea. A child's brain is not just a smaller version of an adult's brain. Nope, it's a whole different universe, one that's developing and changing at a truly mind-blowing speed.
So, let's just jump right in with a question that gets to the very heart of this. Why do babies have that soft spot on their head? I mean, it seems like a weak point, right? A flaw? Well, as we're about to see, it's actually an incredible design feature, a brilliant piece of biological engineering.
Okay, let's get into it. Our first stop is all about the unique anatomy of a child's nervous system. And this is so important because it's the foundation for understanding, well, pretty much everything else, from how they get injured to how they hit all those amazing developmental milestones.
Okay, so first thing you notice, proportions. Think about this. A newborn's head is a whopping 25% of its entire body length. Compare that to an adult, where it's only about 12%. The implication of that is huge. That big, heavy head puts them at a much higher risk for head and neck injuries when they take a tumble.
And this, right here, is the answer to that question we started with. An adult skull? It's rigid, all fused together. But a child's cranium has those fontanelles, the soft spots, and sutures that haven't fused yet. This makes their skull pliable, almost flexible. It's an amazing safety valve that lets the skull expand a bit if pressure builds up inside. But there's a flip side. If that pressure spikes too quickly, it becomes a surgical emergency.
Another huge piece of the puzzle is a process called myelination. The easiest way to think about it is like insulating electrical wires. Seriously. At birth, most of a baby's nerve fibers are pretty much bare. As this fatty myelin coating develops over time, nerve signals start to travel way faster and more efficiently. This is literally what we see when a baby develops new motor skills and reflexes. It's the wiring getting insulated. So, we've seen how unique a child's developing nervous system is. But what happens when things don't go according to plan? What happens when that development gets disrupted? Let's take a look at where some of these pediatric neurological disorders come from. When you break it down, these disorders tend to come from three main places. You've got congenital or genetic issues, which are there from birth. Then there are perinatal complications, things that happen right around the time of birth. And finally, you have acquired conditions, which develop sometime after birth. Let's look at a quick example of each.
So for a congenital example, a classic one is a neural tube defect like spina bifida. This is something that happens super early in pregnancy, when the spinal column doesn't close all the way. It's also a really powerful reminder about prevention, because we know it's often linked to a simple folic acid deficiency.
Next up, you have perinatal complications. Hypoxia, which is a lack of oxygen during a difficult birth, can have really serious consequences. In fact, it's one of the main causes of cerebral palsy, which is a condition that impacts a person's muscle tone, movement, and posture.
And last, you've got acquired conditions, which can pop up any time after birth. A really serious infection like meningitis, for example, can cause the brain and its protective membranes to become inflamed, and that inflammation can lead to severe neurological damage.
Okay, so with all these different potential issues, you might be wondering, how on earth do doctors figure out what's actually going on inside a child's brain? Well, that brings us to the diagnostic toolkit. In the imaging world, two of the heavy hitters are the MRI and the CT scan, and they're used for very different things. An MRI gives you these incredibly detailed pictures of soft tissues, which is perfect for looking for things like tumors. The trade-off? It's slow, and you often have to sedate a wiggly kid to get a good image. A CT scan, on the other hand, is lightning fast. It's the go-to for acute trauma, like a bleed or a skull fracture, but it does involve a dose of radiation.
But what if the problem isn't something you can see, like a fracture? What if the problem is electrical? That's where the EEG comes in. By placing a bunch of electrodes on the scalp, doctors can literally read the brain's electrical activity in real time. This makes it the absolute gold standard for diagnosing seizures and understanding epilepsy.
Getting a diagnosis is a huge step, and from there, the whole journey shifts to treatment. And it's so important to remember that it's rarely just one single fix. It's a whole spectrum of hope and help.
So, what's in this treatment toolbox? Well, it's packed. You've got medications, like anti-seizure meds or muscle relaxants. You have surgical options, like removing a tumor or placing a shunt. Then there's the whole world of rehab, physical, occupational, and speech therapy. And now, we're even seeing these incredible, cutting-edge gene therapies for some genetic conditions.
Let's make that a bit more real. Take a condition called hydrocephalus. That's when excess fluid builds up in the brain, raising the pressure. The solution is this really clever piece of medical plumbing called a VP shunt. It's basically a thin tube that a surgeon places in the brain to drain that extra fluid. It then redirects the fluid under the skin down to the abdomen, where the body can just safely absorb it. It's a truly life-saving device.
All the medicine and the science, that's really only half the story. The human side of this, the caring, the coping, for both the child and their family, that's just as important, if not more so.
So for parents and caregivers, knowing what to look for is absolutely key. For epilepsy, the thing to remember is that it's about recurrent, unprovoked seizures. With meningitis, you're looking for that scary triad of symptoms: fever, a stiff neck, and a severe headache. That needs immediate attention. And for hydrocephalus in a baby, the big red flag is a rapidly increasing head circumference, or HC, which is a direct result of that increased intracranial pressure, or ICP.
And we have to talk about the impact on the child. Living with a chronic neurological condition it's just incredibly tough. Beyond the physical stuff, these kids often struggle with feeling different from their friends. That can lead to problems with self-esteem, social isolation, and just massive disruptions to their school life. It's no surprise there's a higher risk for anxiety and depression.
And that impact, it ripples out to the entire family. This quote, wow, it just says so much. It talks about the incredible stress, the financial strain, and this powerful idea of chronic sorrow, grieving for the child and the life they had originally pictured. It's a profound emotional journey.
The science and the medicine are moving forward at an amazing pace, which is fantastic. But it kind of leaves us with one final and really vital question. Beyond the hospital, beyond the doctor's office, what can we do? How do we as a society build a more supportive, more inclusive, and more understanding world for these children and their families? That's something for all of us to think about. Thanks so much for joining me.